Hi, my name is Bettini. Today I'm presenting a case of Sally. She's 42 years old female that just had a post-operating surgery for the glenohumeral joint. She's has a limited range of motion. She has a decreased mobility, and she has an inability to do certain exercise like lifting up and down. And currently, she has a sling. She has a sling because of what the physician have told her that not to do certain exercise. She has a precaution like flex of the elbow, extension. She can do it. Some exercise like internal or external rotation not greater than 45 degrees. So uh, Sally is in the maximum protection because it's 5 days, and with priority is the healing process. So we have to protect the repair while doing that. Nevertheless, I decided to do certain exercise for intervention for her. So I'm gonna start with prom because to prevent stiffness and to improve mobility. So the prom, I'm gonna have Sally lay on the table, supine, and I'm gonna just passively hold because she can move. Take her hands to the range of motion, like flexion of the elbow up to 90 degree, pain free, gently, and I'm gonna do that 10 times and repeat 3 sets. And if I find out that Sally can do certain exercise, I'm going to try and do some isometric exercise because these are the exercises that Sally can actually do to increase the activation of the muscle. I'm going to have her on the wall. Yeah, I'm going to have her on the wall. I will have a tower like this tower. Sorry, it's too big, and I'm not in a big room. And then let me just move this camera so you can see properly what I'm gonna be doing. Okay. For internal rotation, I'm gonna tuck a tower in here, and I'm gonna have Sally just push against the wall, hold it for 5 seconds, and then repeat that 10 times. Okay, and then for external rotation, I'm going to do the same thing. I'm going to have her use a tower and then push against the wall, hold it for 5 seconds, and repeat that 10 times. Okay, so and I'm going to tell Sally that she is in a maximum potential. When she gets home, she should carefully do this exercise, and then to notice when we can progress Sally is when we're going to realize that the pain have decreased, but she has improved mobility, and then there's no more stiffness, and then in that case we can actually improve and progress with Sally. This is Bettini. Thank you. My next patient is Wayne. Wayne has surgery 6 weeks ago, SP, and he has a core fractures. So sort of like he fell. He's an engineer. He probably fell and then overstretched his wrist. He has core fracture of a left upper radius. So he came in with pain and weakness and some limited range of motion of the wrist flexion and extension. So, and then being that he just got removed, he cast yesterday, he probably have some a lot of scar tissue and swelling and everything. So as an intervention, I'm going to definitely do a cryotherapy for Wayne to reduce swelling and inflammation. And as part for strengthening, as part of decreasing range of increase improving range of motion, I'm going to have Wayne do some active range of motion of wrist flexion, wrist extension, pronation, supination and pronation, just to see how far it can actively doing those exercise. Before then, I'm probably gonna do like a muscle test, like to check all the range of motion. And as far as strengthening, I'm gonna have him do like use like a soft ball, which is can actually practice that. It's probably something you can use at home too, kind of support to practice to improve the strength of his wrist. And he probably have some kind of limitation on the limitation in his hand, like he probably have limitation on his hand for opening a job, or gripping, lifting stuff in the house. It probably have those kind of problems. I have restriction when I know that it's probably being an engineer, he'll be having a problem going back to work. Those will be the limitation, participation restriction that he's probably gonna have to go back to his work as an engineer, because I mean after that it will take a long time to be if he tolerate. And I'm gonna do another muscle test to see how he improve before I progress to the next exercise. This is Bettini. Thank you.